Bismillahirrahmanirrahim. Assalamu alaikum. Today I am going to talk about the spacer device and inhaler in communication station of MRCPCH clinical station. So it is the information giving scenario. So you have to give the information to the parent or the role player about the spacer device. And you are not the one who has prescribed the spacer device. The prescription has been made by the pulmonologist or respiratory physician. So you are there only to give the information to the parents about spacer device and inhaler. So what questions role player might ask? Before I go further, please subscribe channel for further informative videos. And the questions role players are asking in the exam, just keep in mind that this special device, I will show you in the next slide. It might be on the table in communication station. You have to take the special device in your hand and you have to explain on that spacer device while you are finding out to the spacer device in your hand. Okay, so sometimes some candidate they are not taking the spacer device or inhaler in their hand, only they are finishing the station by telling them about the spacer device and they don't touch the spacer device. So when they come out, the result is only they have the 1 mark or 2. So please take the spacer device. So as you know, the general rule and introduction, repo, previous knowledge, and you can ask for any attendant here in this scenario as well. Okay, so after that you started the scenario. So first of all, what is a spacer device? The spacer device has this is the device they use in the small babies to give the inhalers, and so you have to tell the parts about the spacer device. Let me to show you the spacer device first. The other questions: how can I use it? Can I give 2 puffs at the same time? Shall I change after every use, or when should I change? And why should I rinse his mouth or after every inhaler? So these are the general questions they might ask you. Okay, so this is the spacer device in exam scenario, and it has the face mask, which you can say only mask, and here it is the wall, and this is the chamber, and on the back side it is a rubber end in which you will put the inhaler. Okay, this is the inhaler. So these are the parts of the spacer devices. Okay, so if it is the first time for the parents, usually it is the first time, so you have to describe the all parts of the spacer device, which is face mask, wall, chamber, and rubber end. Okay, so after that you can tell them how to use it. First of all, you should ask them if they are already know, and if they know, they might, role player might tell you that how can we use, and they will do the mistakes. So you have to correct the mistakes. Okay, so if it is the new inhaler, first time they open the inhaler, they should shake well before use, and make the 1 puff in the air. Or if they did not use for the long time inhaler, also they will inhale 1 puff in the air. Okay, so this is for the inhaler. Then they should have to put the inhaler on the back side, which is the rubber end. Put the inhaler on this side after shaking well before, and tell the child to breathe out slowly while they are shaking and they are preparing to breathe out slowly, breathe out comfortably. Okay, and then put the mask on the child, put the mask on the child face, which should be covered the nose and the mouth, and make it seal around the mask in the on the face of the child. Means they have to put the firmly to put the face mask on the child face, which should be sealed, not leak. So tell them about the leaking. Okay, then after that, after checking in all these things, they should fit the mask. Okay, after that, they will make the tight seal, and they will give the 1 puff and tell the child to breathe in and out, and while they will breathe in and out, they may look here at the wall. There is a one-way wall, so this wall will move, and if this wall here, there is a one thing which will move on each breath. So they can count this movement at least 5 times, or if 10 times it's much better, otherwise 5 to 10 seconds. Okay, as much as the child is comfortable. So they shouldn't remove the face mask, they shouldn't remove the device until they don't count the 5. Okay, now they might ask you, okay doctor, we have given the one puff, now what about the second puff? Doctor has prescribed 2 puffs at the same time. Yeah, so they should remove and they should repeat all the this step again. They remove the inhaler and then check well used, tell the child to breathe out. They put the face mask again and then they give the puff, and they will count 5 to 10 seconds, or they can see the wall for the movement of the wall, and this movement is according to the breathing of the child. Okay, so after that they might ask you, okay, so how do I know that when should I change this spacer device? Shall I change after every month or after every use? When should I change? Yeah, so before that, this device cleaning, they should remove all the parts of the device. Face mask can be removed, inhaler can be removed, and backside the rubber end, there is a one part, it can be removable. They should remove all the parts, and they will keep this in the warm water, and they will put some little detergent in the warm water, keep in that detergent water for 15 minutes, and remove it from there, wash it with the clean water, and then keep it on this clean cloth until it becomes soak itself. No need to rub, no need to try to soak with the towel or any tissue or anything. Let it to be dry by itself in the normal air. So especially inside of the chamber, they do not touch anything. If they will try to soak inside, the efficacy of the medication which is delivered can be affected, because it develop the scratches inside. It can affect the efficacy of the medication while they use next time. Okay, now they might ask you when they should replace. Yeah, if it is broken, if it is cracked, if it is scratched, they should replace. Otherwise, every 6 to 12 months they have to replace. Okay, so validity, it could be 6 to 12 months and according to the use of the chamber. Okay, so for example, if they don't use this face mask, so how child is only with the mouthpiece. So only the difference here is that child have to mouthpiece. He has to kept in between teeth and hold it with the teeth and make the seal of the lips around the mouthpiece. Same in the inhaler. If they are using inhaler without the chamber, without mask and anything, they are using inhaler, the mouthpiece they will hold in between the teeth and make the seal around the lips. So this is the way of using a inhaler. The remaining technique, remaining things, check well before use, give one inhaler, count 5 to 10 seconds, all same. Only the difference is mask and the other thing. So sometimes they will use the steroids inhaler, and if it is the case orange inhaler, then you should advise that after every use you have to rinse the mouth of the child. Child has to rinse the mouth to protect them from the oral ulcers, means oral apts. So it can affect the oral mucosa. You can tell them that after every use, if they are using steroids, after every use they should have to wash or rinse the mouth. And if it is teenager or old age who is using inhaler only, we can tell them just keep this in your washroom so that you will not forget. Whenever you go to washroom, you use it and keep it there and rinse the mouth at the same time. But in a small babies, we are advising mother to do this. Okay, so for MRCPCH clinical course, now if you are willing to attend a clinical course, now currently I'm offering only course which is a MOOC course, and I did not start yet about the long course. I am preparing the notes for that. So if you are interested to attend MOOC course of MRCPCH clinical, you can contact me on this email, and if you have any query, any question, you can contact me anytime. Thank you very much.